contemporary research study looking at how people living with dementia and their family members are impacted surrounding the care home situation. So I'm going to talk more now about the community element. So when we talk about social support services for dementia, we mean support groups in the community, daycare centres, respite care, but also activities or care provision in the home. So paid home care, paid staff coming into the home and looking after people living with dementia, for example, sorting out meals, medication, getting people dressed in and out of bed. Befriending services as well, so having someone come in, just have a chat, have a cup of tea. There's loads of different social support services, and they're provided by different organizations. And one thing, as we can see in those pictures here, is there's no social distancing. So how would the restrictions of people remain suggested to be separate from one another and not being close to one another, how does that impact on receiving care? We know from research that engaging socially and doing these activities, such as singing and dancing groups, on the left, there's a lady dancing. These are really important for anyone, but also including for people living with dementia, stay well, stay active. So how do these restrictions impact on people's lives? So what we did a two-part study looking at how people living with dementia in the community and their unpaid carers or informal carers have been impacted. So in April, we've done 50 qualitative interviews. That's a big number, and we were only able to do that because we had a great research team. And we spoke to people predominantly on the phone, but if people wanted to have a Zoom interview or generally over the computer, that was fine as well. And then we followed people up, a subsample of those a few months later. Now, a little bit of background about our team. So I mentioned previously that we're not just academics, but our team comprises of clinicians as well, psychologists, we have third sector organizations, support organizations, people living with dementia, carers. And I think this really helped us shape to make this study much more relevant to what's actually happening. So we've done these interviews, and one thing to mention as well, when I've put these slides together, I was mindful that everything seems to change in this pandemic pretty much from day to day. Restrictions are changing so quickly. I'm not saying that these findings are outdated at all. They're still very applicable, but the data were collected last year, 9 months ago or so. So there are new things now that are impacting on dementia care. But from what we found then, back in April, it was quite shocking to see that many unpaid carers, many daughters in this case, that were the most carers that we interviewed, they noticed already that the person living with dementia was deteriorating so much faster. That was in April, only a couple of weeks after the 23rd of March of the nationwide lockdown. So by being restricted to the home, not having these going out to a peer support group, going to a daycare center, or just generally doing something as part of their daily lives, just being at home, not having that cognitive and physical stimulation, seemed to really badly impact on the dementia progression already. And another thing that emerged as well was this general level of uncertainty. People weren't sure and really concerned as to whether the services would resume and when they would resume and how. So would people be allowed to go back in with, say, face masks in a few months' time or a few weeks' time? So just to remind ourselves again, in April, I think all of us, we were still, oh, what's happening? This is all, we're not used to this. I feel now, nearly a year in, we've kind of become more acclimatized to all these restrictions. But back then, it was a huge shock to the system as well. And one thing that's really striking as well is that we did notice those faster deteriorations. There was no support basically, or very, very little. So many carers were worried as to whether their relative with dementia would even be able to go back to these services, to these groups, to these centres, once they would resume again, because they were worried that their relative with dementia would have deteriorated too fast already. And then there was this adapting to the new normal. So I think now we've become all quite used to using Zoom meetings, and even with our family as well, having WhatsApp, FaceTime calls, all these things. But we shouldn't forget that most people living with dementia are aged 65 and above, and many people as well, many older adults, there's research out there to support this, is that they may struggle engaging with technology or just setting up the internet, for example, but put on top of that a dementia, a cognitive deterioration, and it's becoming much more difficult in engaging and setting up a support group that's suddenly working over Zoom. But then we also have to consider the issue of more rarer dementias. So some rarer dementias, such as posterior cortical atrophy, so PCA, people with these type of rare dementia do have vision problems. So if you imagine you're looking at a Zoom screen, lots of little boxes of people on there, but the person with PCA can't recognize them. They may struggle recognizing them in real life in a support group, but then doing that remotely is putting even more difficulty on it. So that leaves the question, how beneficial is all of this remote support even? And so I was telling you earlier about the different types of social support services that are included in dementia, that are available. And one type of support service that came out as different to the others, I suppose, differently affected to the others, was paid home care. So on the left side, you see a lady who's being cared for by a professional carer, having a hug, having an embrace, no face masks. This is something we wouldn't picture these days anymore. So on the right side, that's more the new normal in terms of how care is being delivered. So paid home care should wear the full PPE, gloves, apron, visor, mask. So how has this been affected? Because obviously people living with dementia do continuously need this type of support. Just because the pandemic happened doesn't mean they suddenly don't need to be dressed anymore or be transferred out of bed in the morning or getting their medication anymore, all these things. So what we found was a lot of difficult decisions that unpaid carers, so the family members, were facing. First of all, they were worried about the virus being schlepped into the home. So if you imagine, even pre-pandemic, there's a large number of different staff that can visit your home during the week. It could be 10 different paid home carers coming into the home. And that is because there are different time slots during the day. Sometimes it's just, say, a 10-minute time slot in the morning. It's not always the same carer that comes in, unfortunately. So if you think about virus transmission, family carers were really worried that all these different paid carers and home care staff might bring in that virus because they might catch it from caring for someone else in a different home, or they might catch it on their way to work using public transport, and they didn't know whether the paid home care staff would actually adhere to the restrictions. Do they see family and friends outside of working hours? You don't know. So many family carers took that decision and said, no, I don't want to have any more paid home care at home. I'm too worried about it. I don't want my mum or my dad or my husband to get infected with the virus. I want to reduce that risk. But as a result of that, they had to take on a lot of caring hours, and that resulted in increased levels of burden for them. And we do know now, having followed up with some of those people later on, that that increased level of burden taking on these additional caring hours has led many of those family carers to decide, I can't cope with this anymore, but also I don't really want to have different paid home carers at home. As a result, the relative with dementia was faster in entering a care home. But there were also other decisions that were made. So some family carers decided, I just can't cope without having that help of paid home carers coming in. I'm very much aware of the risk that that might pose in terms of virus infection, but I can't cope on my own. So I'm just accepting that risk. Another thing back then was surrounding PPE. It was still relatively early days in the pandemic, and we do know now that accessing PPE was difficult for care homes, which made the news quite a bit, and generally social care staff. But what was interesting was that many family carers noted that some paid home care staff was wearing just gloves, some was just wearing masks, some was wearing everything, and there were also some that were wearing nothing. So one particular participant, she actually had a very blunt conversation with the home care staff and said, I don't want you to come in anymore unless you are in full PPE. I'm too worried about this. You have to wear the full PPE. Okay, so just an overview in terms of the difficult decisions that people were facing and the different directions that they went in deciding this. And here's just a quote from one of those female carers, and she said she couldn't cope on her own, and she was indeed very grateful to those paid carers to come in. Another thing that emerged, particularly surrounding paid home care, is how it was funded. So it depends on the eligibility of people's backgrounds, in terms of whether they get any financial support for receiving paid home care. And this particular lady was really worried that if she were to cancel paid home care, but then because she's so afraid of the virus, but then she wants to reinstate it, hopefully when the pandemic is over, that then she wouldn't get that financial support anymore, because the council might just say, or the local authority, well, you've coped well without this support during the pandemic. Why would we give you money now? We know you can cope on your own, so we're not giving you any more money. So she was in this dilemma, do I cancel it, do I not? But despite her huge fear of the virus, she decided, no, I'll keep them because I will need to have paid home care after the pandemic as well. And it's just these individual, really ethical decisions, I suppose, really difficult decisions that people have been facing that doesn't seem to be as big, like there doesn't seem to be that much awareness of it. Lots of the news is just about care homes, which is a huge issue in itself, but we shouldn't forget the majority of people living with dementia live in the community, live in their own home. So what are all these issues affecting people and unpaid carers in the community? So then 3 months later, we've conducted 20 follow-up interviews with unpaid carers and people living with dementia. And again, on the left, you have this pre-pandemic, no social distancing. On the right, that's the new normal. Pretty much everything's done remotely, if anything is done remotely. And for example, window visits and just keeping the distance. There were quite a few things that came out in those follow-up interviews. And just to pick up on that remote issue, on this next page as well. So we've had lots of people saying us, yes, remote support has been improved over those past 3 months. So for example, memory clinics have become much more adapted at providing post-diagnostic support groups remotely. Generally, peer support groups are being done much more easier over Zoom these days, for example. So there's been an improvement over those 3 months. However, what people are also noticing is that it's just not the same. It's just not the same as seeing actually my peers, my friends, actually going to a daycare center. and they were missing that a lot. Also, what came out, now that we're a few months into the pandemic, carers had a better understanding of how their relative with dementia was understanding the pandemic or not. And what most people were saying, what most carers were saying, that it's just a Groundhog Day. They have to repeatedly explain the restrictions and what's going on to their relative with dementia, which can be very burdensome to a carer as well, having to do that every day, multiple times. And also, there were a few instances where people living with dementia normally would go for a daily walk, might even go for a run with their carer, and just generally be active outside. But now, especially during those varied lockdowns, people were supposed to stay in, and we also had the shielding element. So people with dementia were getting really upset about it, and they couldn't understand, why am I only being at home? Why can't I go outside? That created an additional level of emotional distress for both involved. And to paint a more, what we say, quantitative picture here, so I've just described to you some of those findings we've had from our qualitative interviews. So these qualitative interviews have helped us to understand really in depth about the experiences of carers and people living with dementia. But sometimes it's really useful to have big numbers to really understand, well, what's actually happening to those social support services. So what we've done simultaneously, we've done a longitudinal online and telephone survey across the UK. And we wanted to understand, A, how are people and how often are people accessing social support services, pre-pandemic and now at those 3 stages, but also how are they affected in terms of their mental well-being, levels of anxiety, levels of depression. So at the first point, we've had 660 older adults, carers and people living with dementia completing this survey. That was between April and May, so that was really in lockdown 1. Time point 2, around 6 weeks later, just over 480 people then completed that follow-up and entered their data again in terms of how many services they were using, how are they feeling. That was towards the end of lockdown 1, kind of starting with easing restrictions. And then the last time point, roughly around 400 people completed this survey, and that was between July and August. So that was when, towards the end of this time as well, shielding stopped. And that was when restrictions were eased as well over the summer, okay? So really different restrictions times as well. So what you can see on this slide here, we looked at the data from all those 3 time points, including what people were telling us what was happening pre-pandemic. And in this particular figure, you see all participants combined. So what you can see on the very first bar, on the light gray one, that's pre-pandemic. And we've looked specifically at different types of social support services, those that seem to be used the most pre-pandemic. You can see it was, well, quite high, around 17% were using paid carers, support groups. Lots of people were using social activities in the community. Could be anything, could be a swimming club, a walking group, going to the pub, dancing, anything. So over 25% were using that. And then you see the drop. So the darker gray bar indicates what was happening between April and May, how many or, well, how few services people were accessing. You can see this huge drop. And what's interesting is that when you look at this figure, if you look at the paid carers one, it seems that paid carers seem to be the least affected. And again, that's kind of reflected in our qualitative findings, in that some people were just saying, well, I'm aware of the risks. I can't cope otherwise though, so I'm continuing to have paid carers coming into the home. But another thing that also you can see here is that whilst very minimally and only for some of those services, there seemed to be a little bit of a trend from across time point 1, 2, and 3 that services were used a little bit more again towards time point 3, except social activities and befriending services. They were stagnant, they were just low, and nothing seemed to have changed. And on this next one here, this is just specifically looking at people living with dementia and current carers separately. And this is just from our baseline survey. And again, it shows that service usage was declining. Okay, so from pre-pandemic to time point 1. And if you look at the none, it's on the very right of each of those figures. And the dark blue shows that, well, there's much more people, there's a larger proportion of people who are accessing absolutely nothing at time point 1. So that is in the middle of lockdown 1. And as I mentioned, we were also asking people about their levels of mental well-being. That includes anxiety, quality of life, and depression. So in terms of anxiety, it seemed that having reduced levels of access to social support services, so not being able to go to daycare centres, going to support groups, having a befriender coming in, that was linked to higher levels of anxiety in people living with dementia and older adults. And mental well-being or quality of life was reduced for those people who were accessing less. So this was particularly pronounced in unpaid carers and older adults. So what we call statistically significant. So the fewer services someone was accessing and using, the lower their quality of life was. And that really shows how important these social support services are. So from those findings, some implications so far. Remote support is not the same. It can help in some ways. It's better to stay connected this way than not at all. But really, there should be a drive towards somehow enabling this vital care, these vital services again, in whatever capacity. But it's also dependent on the individual, because some might not want to go to these face-to-face services, even though it might be socially distanced, they might wear face masks and all these things. So really, support should be enabled where possible, but also obviously we need to be mindful of what situation we're in. Now, vaccinations are over 15 million now, which is fantastic, first doses, but that wasn't the case when this data were collected. So it's always putting it into context of the current situation we're in. But also there needs to be better support to make decisions of whether to receive or use face-to-face care services, which is something that seemed to be lacking. And I'll talk about it in a few minutes about the care home study as well. But generally, there seemed to be a lack of communication or guidance in terms of social care services and connecting between people living with dementia and families if they don't live together, including in care homes. So one thing that the Alzheimer's Society has done quite early on is they've done companion calls. So normally the Alzheimer's Society does befriending services. So someone comes into your home, has a cup of tea, or they might go for a walk, for example, with a person with dementia, to enable a little bit of a respite for the carer. And so now they've adapted this to provide remote and safe companion calls. And one thing we've done as well in October, so we've collected all these data, we've interpreted them together with carers, clinicians, service providers, people with dementia. Okay, so we knew that there was a huge issue in terms of community-based dementia care because of the pandemic. So how can this possibly be adapted during the pandemic to provide better care for people living with dementia and carers? So we've had a workshop of, I think it was around 40 people, 40 clinicians, psychologists, people affected by dementia, providers, and we were having chats about, well, these are the findings, what can we do now? So some of the things that emerged was that services should be flexible. So it might not be, usually it will be a rigid time where someone comes to see someone, but maybe some people need an evening call, for example. And also using all possible channels of providing information on support. So it might be that many people living with dementia might not be able to use their email, for example, or social media. So how else can they be supported better? Over the phone or post, or could there even be some face-to-face support? And as I mentioned before as well, taking that individual approach, so everyone has their own preferences in terms of how to engage with care and support services during this pandemic. So providers and clinicians need to be mindful of that. Also, something that seems to have progressed quite much better over the past year is that the provision of remote services. So support with using internet-based services. There was a notion in that people with dementia should be, I suppose, getting some better guidance in whichever way possible to be able to use Zoom calls, for example. But then we need to be mindful again, for some, this is of no benefit if they have, for example, a rarer dementia and can't really see those different people in the different Zoom boxes. Again, taking that individual approach. So it's really for us as researchers as well, because we're doing these things, we're highlighting that's an issue, but then so what? So we wanted to do something that hopefully helps a little bit along the way. And so at the moment, we've finished this study in the UK, but we were approached by a number of countries to replicate this study and produce a cross-country comparison. So at the moment, we are analysing data with Australia, Italy, Poland, and India. All of them have done interviews and the survey as well to see how dementia care has been impacted. And what's interesting so far is already, as you will notice, India is kind of, I suppose, the odd one out. It's a lower middle income country. Culturally, very, very different. How are services provided? And it appears already from looking at the data and comparing it across the 5 countries that dementia care in India seems to have been affected less than in other countries because of cultural and religious attitudes towards care. So care for someone living with dementia is mostly provided within the family. They wouldn't go into a care home. They wouldn't necessarily access services. Some do, but not many. So it seems like that people that have used services or paid home care, like in the other countries, including the UK, have been affected much more. And then also, I'll go into more detail about our care home study now a little bit, but just to say as well, we are also doing international comparisons with our care homes work, specifically with the Netherlands. And I'm not sure whether you're aware, but it appears that the Netherlands was the very first country who has, well, the government has provided specific guidelines as to how care home visitation should take place. That was in May last year, so very early. And we want to compare, well, how are these experiences surrounding care homes? So I've just spoken about our community-based work, and just to make you aware, that was a snapshot of what we found. There's so much more data, so many more findings, but I hope that gave you a bit of a meaty overview of that study. Now I'm going to talk a little bit only about the care home study because that's still very much ongoing. So what we wanted to do in this care home study, what emerged in our community-based study was that, well, some people are entering a care home now because of those lockdowns, faster deteriorations. So what's the situation in care homes? How is care being provided during this pandemic? What are the experiences of family members trying to engage and see their relative with dementia in the care home? So what we've done is we've done over 40 interviews again over the phone or remotely over the computer. with care home staff and with family members across the UK. And we wanted to understand, what's care provision like? What's visitation like? Are you even seeing your relative? How has that been like? And really so we've done these interviews between mid-October and mid-November. That was before the vaccination started in December. So back then, what we found was very, very poor communication and guidance, both for care home staff in terms of how to enable visitation, but also for family members. Many family members felt at a loss. They weren't aware of what's going on with their relative. They rarely got an update. They rarely got to see them, if at all. And also it seemed like even when they were able to do the window visits or pod visits, at specific pods in some care homes, that didn't really seem to be that beneficial for the relative with dementia. They were struggling understanding, why is there a window, where's there glass in between, why is everyone wearing face masks? Again, replicating what we found in the community, this lack of understanding what's going on here. So it was quite upsetting to family members doing these types of visits. But now, as we're analyzing those data, and as I said, the pandemic seems to change the situation so quickly. So we only collected the data until November, which in research terms means we're being quite fast doing this analysis. But vaccination's happening, which is very positive. But how is that impacting now on things? So we're doing follow-up interviews in a couple of weeks' time, because we want to understand, has the vaccination process and maybe different guidance in terms of restrictions, testing procedures, how are they impacting on those visitations? And will it still be window visits or pod visits for a long time? Or will there actually be some closer face-to-face visits very soon? So we're analyzing the data now. Stay tuned. And lastly, really, just a really big thank you to all those participants. We've been inundated with requests to take part. We sadly had to say no to some people because we already were over-recruited. But also to thank all of those organizations and people with dementia and carers to help us shape this project. So thank you very much.
Hi, Clarissa. Thank you very much for your very informative presentation. And just to put the presentation into context, we asked Clarissa to come along today and do this presentation because we were very aware that a number of our supporters and followers and people on this call had taken part in the research. And we think that it's vital when people have taken part that they get some feedback. And whilst it might not be Lewy body dementia specific, I think in the current environment, it's very essential that we have this kind of feedback, because I think it doesn't matter whether it's vascular dementia, it's Alzheimer's, it's Lewy body, people are experiencing a lot of the same problems. Everybody is experiencing the lack of services and the implications of that. And having been on many of Clarissa's calls and help with some of the coding of this research, I think it's very, very essential. Clarissa, just one question for you from me. How difficult did you find it to respond so quickly at the start of the pandemic to get your research up and running and get ethics approved?
I felt, first of all, I felt a bit sad that we had to put on hold all of our research, because it was really just looking at different angles of dementia care. So suddenly we were told, you shouldn't look at that at the moment, you have to focus on COVID. It was lots of late nights working and trying to put everything together. But luckily, the University of Liverpool responded quite quickly as well. And I must say that the ethics and everything were diligent, but quickly in enabling us to do this research.
And for anybody that's not fully aware of the kind of, we say, ethics, so when people respond to these questionnaires, take part in phone calls, Clarissa will, behind the scenes, have had to go through this ethics program to make sure that the data and the responses that you give are protected and that your information is secure, and that it's anonymized and it's only shared and put into papers and put into the statistics that Clarissa's just demonstrated in an appropriate way. How many papers have you got written at the moment, Clarissa?
Well, we've got 5 published, and we've got 2 more accepted with revisions and a number more submitted. So I think this is another thing, having this big team, but also I think the pandemic has enabled us to connect with fellow researchers and support providers so much easier remotely. Everyone's on social media now, everyone wants to work together, and I think that's really enabled doing, I suppose, much more interesting research, working with outside organizations and peers together.
Just one comment in the chat box. At the moment, Clarissa, somebody's now not seen her mum for over 12 months. And the care home still has its doors closed, even though her mum and other residents had their first vaccine dose in December. And when she Skypes her mum, she can see 12 other people, carers, sitting around the bed with her. So is this kind of typical of the findings in your research?
That's a very good and very sad experience. I'm sorry to hear that. I think this is precisely why we're doing those follow-up interviews. We're starting on the 1st of March, because when we did the baseline interviews for the care home research, again, that was done a few weeks before we even knew the vaccination would happen, and so quickly as well. So hopefully we will capture that. But I think one thing that we did capture in those baseline interviews already was that many family members seem to experience this type of inequality. So they were like, well, she's seeing her mum in the care home. Why am I not allowed to do that? So there seemed to be lack of communication from care home staff, but also, I suppose, pick and select who can do what and see whom.
Yeah. Has anybody else got any other questions that you'd like to put in the chat box, please, for Clarissa? Just some other comments that are coming through. Somebody said that they don't get any external support at the moment, so it was interesting to see what was available. Thank you very much to everybody who is taking part in this very valuable research. My mum's in a care home. My mum's care home have made me a volunteer at the home. I get tested every week with all the other staff, so I can still see my mum. She doesn't get out of bed, so has no other social interaction apart from the staff. So I am very grateful that they have allowed me to do this. And that seems where people are able to do that volunteering. It does seem quite a good solution.
Yeah, one of our participants in those care home interviews said as well that she was being made a volunteer so she could see her mother on a daily basis in the care home. But that was an, as we call, outlier, a very, very unique situation that many people don't experience.
And somebody else who is an unpaid family carer and who is doing an NHS video about my journey caring for a person with alcoholic dementia. I have carried out dementia research for 2 years, working in a care home. Trying to get a COVID jab for a loved one has been stressful.
Yeah, okay. Yeah, I suppose we will pick this up very shortly in our follow-up interviews.
And somebody else saying, we have access to activities taking place on Zoom, but my husband shows no interest whatsoever in participating, even though I try to encourage him. And I think you talked, Clarissa, about the problems that people can experience if they just see these various boxes appearing on a screen in front of them. Because obviously one of the symptoms or one of the conditions of Lewy body dementia is that visualization and potentially seeing some objects zooming towards you. So you can imagine if you've got like 9 or 12 boxes on a screen, it's very difficult to focus.
Yeah. No, yeah, and with other rarer dementias, we found that as well. I'm still really concerned about, because most of those services are also there to give the family or unpaid carer a couple of hours of just me time and doing things as well, maybe going shopping, reading a book, having a cup of coffee, just being themselves again. So these daycare centres have enabled that. But now, how are you supposed to run a daycare centre remotely? That just doesn't work.
Yeah, and I think part of our worries, and I think for a lot of the dementia charities, and as part of One Dementia Voice, is that will these daycare centres, will these community investment groups have the resources, the staff and the funds to restart again after the pandemic?
Yeah, that's another thing, because of their funding and whether charity based or all these things. Yeah.
And someone else just in the chat box saying that they agree about Zoom activities, that sometimes they make her dad living with Lewy body dementia more confused than providing assistance. And somebody else, I requested a care assessment from social services in November, and nothing has been done except to say that he'll be contacted at a later date. That shouldn't be the normal process. And if you want to drop me an email I'll put the details in the chat box at info@lewybody.org, we can have a separate conversation about that. And somebody else has just said that their daycare centre is actually open for 3 hours at a time, and that his wife actually attends on a Tuesday and Thursday. So I would say that is very kind of not the norm at the moment. So it's very good to be able to do that.
Yeah, I mean, hopefully the vaccination in a few months' time will help reopen daycare centres on a broader scale, but then again, it'll still be there, the virus, so we will still have to be mindful of all these restrictions, etc.
Yeah. Okay, right, so I'm conscious of time, so I'm going to end the call now. But just to say that we have got another session in 2 weeks' time. Details on social media if you'd like to register, and that will be a carers coffee morning. So please do join us if you're able to. So thank you again, Clarissa, for your time today. Very, very interesting. And we've got comments coming in the chat box to say thank you very much, Clarissa. So
thanks for having me,
everybody. Thank you. Bye.
Bye bye.